So how can we tell if there's hip involvement? Well, there's some differences between a hip involvement creating some of the pain versus a back involvement. So a lot of times with our back, not every time, but a big chunk of the times, you'll notice that sitting will make you worse. And then if you get up and you start moving around, you start walking, you actually feel a lot better. Very, very common. Not common for all the backs, but a common for a big chunk of the back. Well, if you have a hip component, you typically feel worse with sitting because the hip is in a bent position, and you feel worse with walking. You don't feel better with walking. And that starts giving us clues as to, there might be a hip component in here. Not always the case, but it starts making us think. Now, we also we should have limited range of motion in the hip. Almost always there'll be some sort of limited range of motion in that hip.